managing in everyday life. How to manage and how to make the quality of life of the person with dementia, because we are talking about this. It's visible in residential care settings, in daycare centers, but now we introduce in home treatment as well. So we are trying to use the potentials of the person, then to learn caregivers how to use these potentials and how to make them more functional in everyday life. We structure their daily living, learn them how to live with dementia. It depends on the environment. So if you talk, for example, home treatment, first we have to get to know each other, environment, and the person and caregiver, to know their strengths, abilities, and to accommodate it, to make the best. Sometimes very simple strategies make the quality of life. So education, talk, music, then the learning of the strategies make very simple chores even more simple to get more functional abilities of the patient. Caregivers need support. They need sometimes a little bit of spare time. Then working with the patient is actually give a rest for the caregivers. We can use music, cards, playing cards, something we can find in the home, bringing patient into kitchen and finding what is able to do. For example, peeling potato, or simple ironing, or making very simple chores, make them better, learn them how to dress off, dress on, using toilets. There is a lot of possibilities, especially in the home. Then in residential care settings and in there, they use creativity. We can use Montessori equipment. It's pretty similar, train brain equipments, cognitive stimulation, learning something new. Although amnestic syndrome is there, but we have to try. This is very important because you bring dignity in the life of the patient. The more they are functional, independent, the more dignity you give them. And you bring them joy and laugh, and you have exchanging of emotions. And this sense of play, it's very important. You bring life to the people, dignity and life, and smile. We have to work in a team. So sometimes we overlap our duties and chores, but there are some specificities. We work with physicians, neurologists, psychiatrists, and give them information about the functionality. Sometimes we can have insight in the cognition and all this behavior disturbance. So we give information, and we need to be deeply involved in communication in all these professionals. I think that the problem is that there is a lack of time to change information around the team. then it would be good to exchange information and to know what's going on with the patient. And the most important need is quality of life. So I think that this multi-level communication is very, very important, and exchanging information.